So my name is Johan Alberts. I'm the Director of IT and Transformation for Alliance Medical. We've been working with Lumeon now on and off for the last 8 years or so. I think for us, we knew we had an issue at Alliance Medical whereby we had different pathways and different client needs. And the issue for us really was how to control those pathways, get as much efficiency out of our business, while at the same time not stifling flexibility and innovation. So the issue I think that helped us solve is to get visibility of our business, help us to mechanize and automate a number of our workflows and our pathways all throughout our entire business that actually serves the needs of all of our clients. I think there are a number of examples where the workflow automation really started helping us quite a lot and produced a significant return on the investment that we put in place. I guess a couple of smaller examples is around one of our clinics where we had a full-time member of our finance team just working that particular clinic 8 hours a day just to sort out the billing side of things. Once we've introduced the system, that actually reduced down to about half an hour a day, so that's a massive cost saving from our perspective. And at the same time, we started getting real-time visibility of what was going on from a revenue perspective within that clinic, so it was definitely a big win for us. Other examples include where we started making and seeing improvements on our clinical pathway itself. So to give you an example, it took us on average about 6.5 hours or so to go through the motions, do all the necessary checks and actually distribute reports and images back to our referring hospitals and our referring clinicians. Through the workflow engine and through the work we did in re-engineering that process within the Lumeon system, ultimately we managed to reduce that down to less than a minute. So that's more than 2 orders of magnitude difference from where it was before. Not only is that a win from an operational perspective, it's a win from a cost and a finance perspective, and ultimately the patient and the clinical side of things win as well. So it was really a win-win-win for us. We ultimately settled on a specification and settled on the Lumeon system purely because it gave us a lot of control in terms of managing our pathways and our workflows, but at the same time it gave us the ability and the flexibility to actually manage and change that and tweak it over time internally. So it's a fully in-house capability, and actually I can change with my team specific workflows in the space of a couple of days as opposed to it being a couple of months where it was in the past. And I think this was one of the key features allowing us to go after quite large contracts, our national PET-CT contract being a good example in that sense. I think the Lumeon system was one of the key features we put forwards in our tender, and ultimately not the only determining factor, but was one of the key features that actually allowed us to secure the contract. If you talk about analytics, I think that is one of the core elements underpinning the reason we went for a new modern platform and a new modern system which Lumeon provides for us. We believe that the underlying data in everything we do is going to be core to how to innovate and understand unwarranted variances going forwards. From our perspective, it was very clear that we had different throughputs in some of our clinics. We had different costs in some of our clinics to provide exactly the same service, and we couldn't really explain why that was the case. So if you talk about the underlying data, which we now have the ability to extract and to mine and to start interrogating, I think that will be core to our continual innovation going forwards. What I like best about working with Lumeon is the fact that the team is quite innovative in how they approach quite tricky problems for us. If you look at our organization, we've got quite different clients and quite different client needs, and that ranges from a walk-in self-pay patient off Harley Street all the way through to an NHS national contract patient with very strict parameters and service levels to go with it. To manage all of that variety across an estate of mobile trucks, effectively, as well as static facilities anywhere in the country, and a separate reporting workforce, is actually quite a tricky problem to solve, and is not one that I found anywhere else apart from the Lumeon team offering a solution, which I thought was very innovative and effectively helped us along this journey.